Hello everyone, a warm welcome to all the viewers. My name is Priya Singh Rangey and I am an assistant professor at the LG Institute of Physiotherapy. The topic that we'll be discussing today is about disability. We'll be discussing impairments, disabilities, handicaps, how disability can be prevented, what is disability screening, what are the aims and objectives of it, what are the types of disability screening, and what are the uses of disability screening. Now, before starting with what disability is, we need to have a basic idea about the sequence of events that lead to disability. In the presence of a disease, there are certain impairments. These impairments lead to a disability, which ultimately becomes a consequence of handicap. Now, beginning with what is an impairment, as we can define impairment, it is any loss or abnormality of psychological, physiological or anatomical structure or function. The examples that can be cited are the loss of a foot as seen in an amputation, defective vision or mental retardation. When we talk about impairments, there are several types of impairments, like you can have progressive impairments, you can have regressive impairments. There are visible impairments, there are invisible impairments. We can have primary impairments or secondary impairments. Now, these primary and secondary impairments are important. Why so? Because a primary impairment is a direct consequence of the disease itself, whereas a secondary impairment is a consequence of the primary impairment. Let me explain it to you with an example. If we think of an individual who is suffering from leprosy, the leprosy here is a disease. Because of the leprosy, there is a damage to the nerves. This damage to the nerves is a direct consequence of leprosy and hence can be cited as a primary impairment. Because of this damage to the nerves, there are certain sensory impairments like sensory loss. This sensory loss leads to plantar ulcers. Since these plantar ulcers are due to the sensory loss, that is a consequence of damage to the nerves and not a direct consequence of leprosy itself, the plantar ulcers can be called as secondary impairments. Next, talking about disability, any restriction or lack of ability to perform an ability in a manner or within the range that is considered for a normal human being. So when we talk about impairment, we are talking about any particular organ, a body part, any anatomy, psychology or physiology. But when we talk about disability, it is not any body part that we are talking about. It is the ability of an individual that we are talking about. It is a function of an individual. For example, we can say that the loss of foot can be called as an impairment. But when a person is not able to walk because of that loss of foot, the loss of walking can be termed as a disability. Similarly, handicap occurs at the level of society when the individual is not able to fulfill their social roles, when the individual is not able to participate in the society the way they used to. Handicap is a disadvantage for a given individual resulting from an impairment or a disability that limits or prevents the fulfillment of a role that is normal depending on age, gender and social and cultural factors for the individual. The way we thought of disability in terms of function, similarly when we talk about handicap, we are talking in terms of the social participation that an individual carries on him or her. When we talk about a person needs to earn in order to be financially responsible for their own selves, for their families, etc. For these financial responsibilities, these can be termed as the social role that the individual plays. If a person cannot walk, the person cannot commute to their place of employment. Due to this, the person might not be able to continue with their employment, leading to a handicap, since the patient will not be able to fulfill their social responsibilities. So this is how the disease leads to an impairment, impairment leads to a disability, and disability leads to handicap. When we talk about disability prevention, it occurs at three different levels. We have the level of the impairment itself, where the disability prevention can be termed as primary prevention. Disability prevention can occur at the level of disability itself, which can be termed as secondary prevention, and at the level of handicap, where it is termed as tertiary prevention. When we talk about primary prevention, we are talking about reducing the occurrence of impairment itself. In order to do so, we can use different types of measures like immunization, vaccination, using preventive measures, etc. In secondary prevention, the focus is on providing appropriate and adequate treatment to limit the amount of disability. Whereas in tertiary prevention, we are trying to prevent the transition of disability into handicap. The next thing that we'll be discussing today is about screening, more specifically about disability screening. The iceberg phenomenon of disease states that a far larger proportion of disease is hidden from view in the community than is evident to physicians or the general public. The search for unrecognized disease or defect by means of rapidly applied tests, exams, or other procedures in apparently healthy individuals is termed as screening. The points that need to be focused here are that screening is a search for unrecognized diseases or defects. The means through which we are performing screening are rapidly applied tests, exams, or such other procedures, and screening is performed among apparently healthy individuals. So three main points need to be focused here. Unrecognized disease or defect needs to be searched or identified. It is done using rapidly applied tests, exams, or other procedures, and it is done in apparently healthy individuals. It seems to the novice mind that there is no difference between screening and periodic health examination, but it is not so. A screening test has a wider application, it is relatively inexpensive, and it requires little physician time. Similarly, screening may also seem similar to a diagnostic test, but a screening test is not intended to be a diagnostic test. It is just an initial examination. If the test results for a screening test come back positive, then the individual is referred to a physician for further diagnostic workup and treatment. A screening test is usually done on apparently healthy individuals, whereas the diagnostic test is done on those with indications or who are termed sick. A screening test is applied to groups, whereas the diagnostic test is usually applied to single patients. When performing a screening test, there is only one single disease in the mind of the investigator or the agency. For example, we perform screening tests for diabetes, hypertension, breast cancer, etc. But when we are performing a diagnostic test, we have several diseases in mind. The screening test is based on only one criterion or a cutoff point, whereas for a diagnostic test, it is based on the evaluation of several signs and symptoms and lab findings. A screening test is comparatively less accurate than a diagnostic test. It is comparatively less expensive than a diagnostic test. A screening test cannot be used as a basis for treatment, whereas a diagnostic test can be. In a screening test, the initiative usually comes from the agency or the investigator, whereas in a diagnostic test, the initiative comes from the patient themselves. When we talk about the aims and objectives of screening, we can say that screening is used, or the screening aims to identify from a large group of apparently healthy persons those that are likely to have the disease or are at increased risk of the disease. The purpose here, the aim here, is to identify such people who might be at greater risk or who might actually be having the disease. We need to identify these people who seem to be apparently healthy or apparently normal, and we need to bring them under medical supervision and provide them appropriate and adequate treatment. By doing so, we are performing an earlier diagnosis which can help in altering the natural history of the disease. There are basically three types of screening. You have mass screening, high risk or selective screening, and multiphasic screening. A mass screening is a screening of a subset of a whole population. Example, screening of adults, infants, children, etc. In a high risk or selective screening, we use epidemiological research. Using epidemiological research, we try to identify people who might be at higher risk of developing any particular disease. And then we perform screening of this high risk subset or subgroup of the population. Example, we know that through epidemiological research that cervical cancer tends to be a little less prevalent among people who belong to upper social groups. Hence, we can perform a high risk or selective screening among the females who belong to lower socio-economic groups. Multiphasic screening is a screening that uses multiple, 2 or more tests at the same time on the same number of people. The benefit here is that we can screen for several diseases at the same time. Hence, we can save on resources and save on time. The procedure usually includes a health questionnaire, an examination, and a range of various measurements. The uses of screening can be case detection, which is also known as prescriptive screening. Here, the main benefit is to the patient themselves. What is done is, we are trying to identify people who might be having the disease from a particular population. The second use is controlling the disease, which is also known as prescriptive screening. Here, rather than the individual benefiting themselves, the benefit is more to the general population. Since by identifying the people, we are trying to provide them appropriate treatment which helps in controlling the spread of the disease, like screening for tuberculosis or syphilis. Screening can also be used for research purposes. When it is used for research purposes, it helps in gaining more basic information about any particular disease, which can later on help in the diagnostic workup. However, it needs to be informed before screening to the individual that treatment will not be provided post the screening process. Screening can also be used for educational opportunities, where we provide opportunities for creating public awareness and for educating health professionals. To summarize, we can say that impairment, disability, and handicap form a sequence of events that can be effectively broken by disability prevention. It includes primary, secondary, and tertiary prevention at the levels of impairment, disability, and handicap, respectively. Screening can be performed for a mass population, a high-risk group, or using multiple tests. Disability screening can be used for detecting cases, for controlling the spread of diseases, and for research and educational purposes. Whatever method is used, screening helps in reducing the amount of disability and should be used to the fullest capacity. Here, I'm signing off. See you until next time. Thank you for listening.